Hi everybody, it's Dana.
And Ashley.
This is A Dash of PT.
So on Tuesday I logged in just to give a quick introduction to the topic we're going to be covering today. And so I picked 4 different exercises that are kind of my go-to for pregnancy, when you're pregnant, or even after, that I enjoy doing myself. I did throughout my pregnancy, and then I also give to a lot of my patients. So there's a lot of different exercises, but I just picked the 4 that I've seen a lot of success with today.
I love these exercises. When I was pregnant with my daughter, I had a lot of sciatic problems and SI joint problems. So these are some things that I did myself when I was pregnant with my daughter. But you're so funny, Denise, thank you. Is there any time during pregnancy that you shouldn't be doing these?
Yes, so I'm glad you asked that. So I think the number one thing is to always check in with yourself and how you're feeling. So if you've been having SI joint pain and a lot of like instability, or you just feel very like tight or like you're having pain down the leg, I'd say always check with your doctor or your pelvic floor therapist first, just to make sure that the exercises are going to be safe for you. A lot of times, because there's this hormone relaxin that's being released throughout pregnancy, your ligaments get relaxed, as relaxin shows, which is what you want, which is part of the normal childbirth process. However, sometimes things become a little unstable. So the pelvis can get unstable, you can get a leg length discrepancy, and those are all things that you'd want to have checked out first before starting these exercises. However, if you've been feeling pretty pain-free throughout your pregnancy and you feel good and you just want to add some more tools to the toolbox for strengthening, these are 4 good ones to go to.
Exactly. So you're going to get on the table.
I'm going to be the
demonstrate. I'm going to apologize now for any technical glitches because I'm operating the camera while Ashley demonstrates the exercises. And we'll make sure to explain them as we go along.
Yes.
And if you guys have any questions as Ashley's going through each of them, please be sure to ask, okay? All right. Are you ready? All right. So we're going to flip the camera around. Okay, Miss Ashley.
All right, so the first one is quadruped. So you're going to be on hands and knees on a soft, not too pushy of a surface, so not like a pillow top bed. But if you have a yoga mat you can put on the floor, that works as well. So you're going to be on all 4s. Your core is going to stay tight. And you just want to make sure that your hands are under your shoulder, your knees are under your hips, you have a space between the knees, and you want to keep core tight. And you're just going to extend one leg backward, bring it back down, relax, and then make sure everything's nice and tight. And then you'll do other leg back and back down. So with that, when you're extending one leg back, your weight should kind of distribute between the 3 limbs that are down. So you shouldn't feel like you're tilting into this hip at all, because we just want to make sure that you're nice and stable as you're doing it. So that's the quadruped exercise. Typically I say 20 times alternating legs, and you can kind of take a break in between as well. So that's 1. And then the next 3, I'll use the resistance band. So there's different ones you can get. Strength-wise, green is kind of in the middle, so I feel like this or like a red is usually safe for most people to start with. So for this one, band goes above the knees. Again, soft surface, but not too soft, and you're going to lay on your side. If you want your knees to, your feet to line up with your glutes, you can rest down on a pillow if you want. You're going to think about squeezing your butt before you lift. So you want to squeeze and then lift up, and then bring it back down, and then squeeze, lift, and back down. So you're just going to repeat that. Usually I give people 3 sets of 10. I do 30 at home. And you're just slowly up, slowly down. You don't want to do this because really you're just trying to use momentum then. So always to isolate here, you're going to squeeze and then lift up and then down. So you'll do one side and then you'll switch and do the other side. So those are clamshells. Then the next one that we do, we'll have to make our way this way. So
wait, I'm gonna go this way because I can see myself in the mirror. Okay,
so
we're switching.
Side stepping. So band around the ankles. You can cross the band if you want more resistance. long hallway at home or basement, standing upright, soft knees, so you don't want to lock them out, but you don't have to squat necessarily for this one. Soft knees, and you're just going to take strides one way, stay facing this way, and then you're going to come back. Toes always stay pointed forwards. Hips don't rotate. You can keep your hands on your hips just to make sure they stay where they should. So that's side stepping. And then the other one I like is, I call them monster walks. You can also call them diagonal walking. But band around the legs still. You're going to step outward and back, join, and then outward and back and join. Again, hip points stay forward, toes stay forward, you're upright, slight bend in the knees, and you're going to be going backward, and then you can go forward as well. So you just want to make sure that you pick a resistance band that is challenging, but not you feel like you're straining or you can't keep your form while you're doing it. So if while you're doing it you feel like you're really straining and your toes turning out, then it's probably too hard of a resistance. But as you're doing it, like this band is a little too weak for me, so I don't feel like I'm really getting too much resistance as I'm going. So you kind of have to play around with the bands to see what would work best for you. But those are my 4 that I go to. There's a ton of exercises out there. We'll probably do another segment at some point with focus just on core, but those are the ones I use. So if there's any questions, feel free to leave a comment for us. Otherwise, we'll be chiming back in about 2 weeks' time. Thanks. Have a great day.
Bye, everybody. Have a good day. Thanks for watching.